Okay.
All right, good. Good evening, everybody. I'm very pleased to see you all here. And I'm very pleased that we don't have to go out in this chilly weather because being at home and having a meeting like this is so much more fun, I think, especially on a cold, wet evening like tonight. But let's get going. We are going to go into part 2 of what we started last week, which is your back and legs. And I'm going to share my screen over here and get going with my presentation. At least try. There we go. If I'm going too fast or you've got questions, please just let me know, maybe via WhatsApp, because I cannot see who's on my screen. Okay, so we're continuing with our body sign language tonight. And one of the things, this is a lot of the stuff that I'm covering tonight is things that I see very regularly in my practice. And one of them is numbness of the hands or feet. The big fancy word for that is peripheral neuropathy. This is a sensory loss in the hands or feet with a feeling like you're wearing socks or gloves all the time. And the sensory loss may be accompanied by tingling or burning. And that's usually in the tips of the fingers or your tips of your toes as well. This sign is characteristic of nerve damage, and nerve damage can be caused by numerous different things. Neuropathy often accompanies things like diabetes, heavy metal or pesticide poisoning, and it may also be caused by gluten intolerance. And that was a new one for me. It is little known amongst health professionals that neuropathy is the second most common symptom of gluten sensitivity. Again, as I said, that was news to me. But gluten intolerance is becoming quite a thing these days. And very, very common. So this is why you are now able to find a lot more gluten-free products on the market. Neuropathy may also be a prediction of Crohn's disease, which is an intestinal problem, or other severe digestive problems when gluten is poorly tolerated. More than half of diabetic patients develop neuropathy, which results from oxidative damage to the nerves. And this is where I see my patients, because with a diabetic, they will lose the sensation in their feet and they stub their toes. Or I've had one patient who was walking on the beach and stood on a rock or a broken shell or something like that, didn't realize it, got infection and ended up losing his leg. And this is very, very common, unfortunately, amongst my patients, and this is why I get to see amputees quite regularly, is through the neuropathy. They also start to lose toes one at a time as the surgeons drop them off. So these are some of the foods and things that one needs to be using in an attempt to control blood sugar. Includes not only blood sugar control, but also the use of antioxidants to protect the nerves from oxidative damage. So as I was saying, the neuropathy is caused by oxidation, and otherwise known as rust. And we need the antioxidants to preserve those little nerves because, as you know, tips of your fingers and your toes have got a very rich nerve source and very, very sensitive over there. Alpha-lipoic acid is an important antioxidant for the diabetic, and 600 milligrams or more daily has been used successfully to treat neuropathy. We will find alpha-lipoic acid in at least one of our products, and for those who are not guests on the program, I'll let you guess which one it is. We will cover that later. Zinc and vitamin E are being, when they're used as antioxidants, have also been successfully used to treat this condition. And vitamin E protects the lipid membranes, which is your fatty outer layer of the nerve cells. Vitamin E is very, very important for this. Zinc aids in the regulation of blood sugar and is essential for the metabolism of fats. And this is the major building block of nerve cells. And your brain is one of the biggest sources of fat or nerve cells, and therefore requires a lot of fats, healthy fats, for energy. Several B vitamins benefit neuropathy by providing energy with which nerve cells can protect themselves and aid in detoxification of substances that can damage the nerves. And this is where Betagard came about, because a lot of it is vitamin B that Dr. Arthur First put together. Because he was a toxicologist, he knew the benefits of vitamin B, and that is why we have the products that we have in Betagard, because that is one extremely potent detoxification product on its own. Alcoholics are inclined to develop neuropathy, which may be prevented by vitamin B1 intake. And alcoholics, smokers, and diabetics all end up with similar issues and quite often end up losing legs. The alcoholic is not necessarily deficient in the nutrient of B1, but has a problem utilizing the vitamin. So you may have the vitamin B in your system, but if your body cannot use it, it's of no use. Neuropathy in elderly non-diabetics is also fairly common if they're lacking vitamin B12 and folic acid, both of which you'll find in vitamin B complex. Vitamin B12 deficiencies develop as a result of lowered hydrochloric acid production in the stomach as we age. And as I've mentioned in previous sessions, the older we get, the less hydrochloric acid is produced in the stomach, and therefore we need to boost that supply with vitamin B. Some of the causes of neuropathy include alcoholism, diabetes, and exposure to toxins and some medications like chemotherapy. I always lose the top of my screen over here. So nutrients that improve the fat metabolism help to reduce neuropathy symptoms. Nerves are primarily built of fat. The type of fat in the diet may alter symptoms of neuropathy, particularly for the diabetic. And what we mean over there is the bad fats or your junk food fats can cause more problems than the good fats like your omega-3s. The gamma-linolenic acid found in evening primrose oil, borage, or black currant oils has been identified as benefiting neuropathy in diabetics. I know we don't have that in our range at present, but we do have other things that work in a similar fashion. Fat, GLA, which is gamma-linolenic acid, is normally synthesized in the body, but diabetics are known to have a deranged metabolism, meaning that their body cannot really metabolize things the way that it should do because of the disease. And this is why diabetes is such a debilitating and dangerous disease to have. Fish oils also benefit neuropathy because it is healthy oils, it's good oils. While fish oil was shown to improve blood flow to the feet and improve kidney function, large amounts may also increase blood sugar levels, which is not a good thing. So one needs to be very careful to have a good balance over there. Neuropathy often follows exposure to nerve toxins, heavy metals, as found in many industrial and agricultural chemicals. Those who carelessly use or expose themselves to toxic chemicals place their health at greater risk than they realize. This is why we have one of the best natural cleaning ranges available that is non-toxic, and they are particularly careful about that, making sure that there are no harsh chemicals which are found so commonly in common household cleaning things these days available in the shopping centers. And this is why we need to educate people that those chemicals can lead to all sorts of problems. These are some of the causes of peripheral neuropathy. I'll let you go through this later in the recording. Suggestions are to avoid gluten if you are sensitive to it. And gluten itself, I must say, is not the problem. Gluten actually has a lot of good properties in it. The problem is we are generally missing the protein needed to synthesize it or to process that gluten. And one of the studies that is coming forward at the moment is that they're starting to say or question if it is in fact gluten intolerance or if it is intolerance to the chemicals that are sprayed on wheat and food for ripening. In other words, your ripening agents. We should avoid heavy metal, pesticide, and toxic chemical exposure. So people in industrial areas are often open to these sort of exposures and need to be careful. We need to eat fish or cautiously supplement with EPA, which is one of the omegas. And as you know, with our omega-3, we have all 8 of the omegas, including the EPA. Most omegas only have EPA and DHA. And when you're eating fish, be careful about where you catch fish if you're eating wild caught fish, because fish specifically found in places like Durban Harbour, Cape Town Harbour are so full of those heavy metals and toxic chemicals as to be pretty much lethal if we eat them. And then vitamin E is also a good thing to be having. And we need to keep the blood sugar stable. And you'll see this as a common thread running throughout this whole series. We need to keep our blood sugar levels stable and balanced. We need to supplement with protein, vitamin B complex, and antioxidants. Debbie, to answer your question over there, yes, you can. It will involve going to see a doctor and having blood tests done. Another common one, and I think a lot of people know about this particular one, and this is osteoporosis. And as I've said before about bone, bone is a little bit like coral. In fact, they're using coral in maxillofacial implants in a lot of cases because coral is very, very similar in structure to our bone. And bone, healthy bone, is flexible and spongy. And if you cut through healthy bone, it should look like the inside of a crunchy chocolate. If you cut through an osteoporotic bone, it's going to look like the inside of an Aero chocolate, more or less. The skeletal structure becomes brittle and weak with osteoporosis. In other words, if you fall, you don't bounce like children do. And scarily enough, I'm seeing a lot more children not bouncing anymore either. They break. So as we get older, we tend to become more brittle and weak. Compression of the spinal column can lead to what is being called widow's hump. So you see these people walking around hunched. I have an aunt that has this problem. And loss of height. And this is why as we get older, we often get shorter. Fractures due to osteoporosis tend to cost millions of rands every year and can result in death. And again, I see this regularly. If anybody has had a hip replacement or knows of somebody who's had a hip replacement, just to put this into perspective, a hip replacement, simple hip replacement, will set you back in the region of about 180,000 Rand. That includes your hospital and physio and surgery and all the rest, but that whole lot comes to around about 180,000 Rand. And elderly people who fall and break a hip often don't. They often break a hip and then fall. Will normally end up with a hip replacement. And there are a lot of complications that go along with it because I work with those people virtually every week. The traditional medical approach to treating osteoporosis consists of large quantities of calcium and medication. And they will prescribe things. They'll prescribe a calcium, but it's a calcium carbonate. And there are quite a few other pharmaceutical grade calciums on the market, which come along with a whole lot of other funny side effects. These medications tend to block the activity of osteoclasts, which are your little bone cells, and this results in more bone mass, but weaker bones. In other words, you shatter when you fall. One of the keys to osteoporosis prevention is to build healthy bones when we are young. And your bones will build up to about the age of around about 23. And from the age of about 23, you start losing bone density. And specifically, this is sped up if you're drinking a lot of sodas and things that are leaching calcium out of your system. Ladies who are pregnant and have had babies, those little people have been sucking a huge amount of calcium out of your body. Unfortunately, the diets and exercise patterns of young people are totally inadequate to produce healthy bones. Again, those fizzy drinks and sitting on the couch watching TV or sitting on their phones, exercising their thumb and not their entire body. Our grandmothers gave their children cod liver oil, knowing that this promoted healthy bones. And vitamin D promotes early development of bone mass, as does vitamin K, which you get from green leafy vegetables. And vitamin D is becoming a lot better known at the moment because vitamin D is good not just for the bones, but also for your immune system. Regular calcium and magnesium intake together with exercise promote strong bones from a young age. And I can tell you that if you have fallen and fractured a bone, the process takes roughly about 6 weeks for healing to happen. First 2 weeks is complete immobility to allow the bone to start to heal. And then the next 4 weeks, you gradually start to put more weight on the bone, because with the weight, that strengthens the bone. And people who are bedbound for 6 weeks while recovering don't have strong bones and end up with problems. Many calcium supplements act as antacids, and in fact, many antacids are made of calcium, and this impairs your calcium absorption. Chelated calcium glycinate does not have the antacid properties of other calciums and is very well absorbed. And this is why Arthur First, again, being years ahead of his time, developed the chelation. We were the first company to come up with this. Many antacids contain aluminium, which has been shown to speed the breakdown of bone and slow the formation of new bone. Scarily enough, we will find aluminium in a lot of other things around us. Significant amounts of aluminium are also found in beverages stored in aluminium cans, and those are also fizzy drinks. Foods cooked in aluminium cookware. Please get rid of your aluminium cookware as fast as possible. Many processed foods contain aluminium. Read your labels. Most baking powders contain aluminium. Read your labels. Some salts and a lot of over-the-counter medications, and I would say the vast majority of deodorants have got aluminium in it. Please read that fine print on your deodorants, because they use the aluminium as an antiperspirant. There are some, very few, unfortunately, antiperspirant deodorants that do not contain aluminium. They are very rare, and you've got to hunt them down, and it took me a long time to find them. And the trouble is, the skin under our arms, which is normally where we use the deodorant, is very sensitive, and as soon as you put that aluminium on there, it goes straight through, and you've got problems. Both progesterone and testosterone promote bone building and prevent bone loss. And this is where the problems come in when ladies have had hysterectomies, because they're losing a lot of that. Looks like my internet is unstable, so please forgive any stutters that are happening over here. Women who have had a hysterectomy are more susceptible to osteoporosis. Dr. John Lee recommends moderate protein intake together with a wide spectrum of minerals and vitamins B6, D, K, and C to prevent bone loss. An overactive thyroid, fluoride, cortisone, and alcohol have negative effects on bone strength, and we've been over the fluoride part before. So the suggestions: be careful of what you're eating and don't eat a highly acid diet. We need to exercise regularly, and that doesn't mean going to the gym. It means parking about 10 parking bays further away from the entrance to the local mall and go for a walk, because that is enough exercise for most people. You don't have to go and push heavy weights. Supplement with calcium, magnesium, and cod liver oil. Our cod liver oil is called vitamin A and D, so just be aware of that. And as we know, we have one of the best chelated calcium, magnesiums, and vitamin D on the market. And then if you're needing extra vitamin D, we can get it from the vitamin A and D. Overseas, this would be known as cod liver oil. And we need to support the stomach acid if it is deficient with betaine hydrochloride. And one can use vitamin B to let the body create its own hydrochloride or hydrochloric acid. And try to avoid using antacids, rather stick to your aloe juice. Use a good multiple vitamin along with quality oils. And I think we all know which is the best one that we have in our range. Gout. And it almost amuses me when I have people come to me with this, because in a lot of cases, they don't have the gout, but it is one of the more common diagnoses that a doctor will give you if you have a pain in the joint. Now, gout is extremely painful. If anybody's had it, you will know what we mean by that. So far, thank heavens, have not had gout, but from the descriptions I've been told, it's not fun. Gout usually begins with severe pain in the big toe, and a lump in the earlobe may be an early clue of uric acid buildup. And to be quite honest, I don't know how that combines with your big toe, but gout is caused by a uric acid buildup. And you think of those crystals like salt crystals trying to get into a very, very small little joint. That's why it becomes so painful. Uric acid crystals are formed from the breakdown of purine and form in the joints. Gout is often associated with low thyroid function, obesity, diabetes, heart disease, and high blood pressure. And if you know people who have got gout, you'll often see all of these things come together. Those with gout have an increased probability of developing kidney disease. Again, quite probably because of the diabetes. Problem is more common in men than women, possibly because men tend to eat higher purine foods, less vegetables, and consume more alcohol. And does this sound familiar? Gout is closely associated with excessive consumption of alcohol and foods high in purines, and this you'll find in things like liver, kidney, heart, and sweetbreads, and also in seafoods like herring and sardines. Other foods with uric acid include yeast, asparagus, peas, beans, and mushrooms. And again, too much of anything is bad for you. Those are some of the foods that cause the gout. Oops, I'm running out of time over here, so I might have to end up cutting this short tonight. Very much. Things are getting hidden over here. High fructose corn syrup hidden in many processed foods is not recommended in people with gout. Rich meats, possibly due to poor digestion, and other foods high in purine should also be avoided. A diet high in raw foods and vegetables is often beneficial, probably due to the high levels of vitamin C, because vitamin C lowers your uric acid levels in these foods. Aspirin and other salicylates inhibit excretion of uric acid and should not be used to treat gout pain. So stay away from things like Disprin, etc. Dr. Almond found that any treatment that benefited gout also tended to produce an improvement in fibromyalgia. That I found very interesting. When undergoing gout treatment, be aware that when uric acid comes out of the joint, it can be just as painful, if not more so, as when it goes in. So be careful of that. Some nutrients in excess can make gout worse. So again, as I said, too much of anything, bad for you. Be wary of using excessive quantities of vitamins A and B3 with gout. The suggestions are avoid foods high in purines. Sounds so logical, as I've always said, but not always that practical or not always that easy. And these are some of the foods that you would see that cause the problems. We need to reduce the intake of sugars, including fructose and alcohol, and improve digestion. All makes sense, but one doesn't always think about it at the time. One of the best things for your stomach as well is obviously the acidophilus, which helps to get the good bacteria back in line. And supplement with vitamin C. And I have made the error of suggesting full motion. Didn't work, so don't use that. And you can also try cherries, which are a good source of flavonoids, which is vitamin C. I'm going to go through this one quickly, and this is restless leg syndrome, because I quite often hear about people complaining about this. And this happens when your legs are restless, jittery, or just tighten up. See, I haven't done my signage over here correctly. This sign may indicate excess caffeine intake or blood sugar problems. And restless legs may also be caused by a lack of nutrients, including iron, magnesium, omega-3, vitamin C, D, and E. Restless legs are frequently accompanied by insomnia, depression, or anxiety when caffeine is a causative factor. So don't have a cup of coffee right before you go to bed if you are easily affected by caffeine. Caffeine is present in coffee, tea, chocolate, soft drinks, and many over-the-counter medications. Again, read your labels. Restless legs may be a sign of elevated insulin and a pre-diabetic or early diabetic condition. Erratic blood sugar levels disturb the functioning of both muscles and nerves. And leg cramps may also indicate elevated insulin levels. It's fascinating how these little signs that we think are nothing can actually be indications of something quite dangerous. Sugar and caffeine may be depressing your magnesium levels in restless legs. Magnesium supplementation appears to decrease symptoms of both restless legs and insomnia. There you go, that's something to help you sleep at night as well. Dr. Michael Murray observed that iron deficiency, with or without anemia, is an important contributor to the development of restless leg syndrome in elderly patients, and iron supplements can produce a significant reduction in symptoms. Low production of hydrochloric acid should not be ruled out as a cause of iron deficiency and restless leg syndrome, particularly in the elderly due to failing digestion. Excess iron intake is toxic and should be avoided. So again, too much of a good thing is bad for you. Vitamin E sometimes provides substantial relief from restless leg syndrome due to its stabilizing the cell membranes. Suggestions: avoid caffeinated beverages. There goes the coffee, but again, not too much. Avoid sugar. And we need to supplement with calcium and magnesium. We have two excellent products of that. We know the CalMag, and now our new magnesium as well. I know I've been seeing some pretty good results out of it. I don't know about you, but I'd like to get some testimonies about that sometime, maybe on a Sunday evening. And we need to supplement with iron if deficient. Sadly, our iron is not available at the moment, but you will find it in the multi-mineral as well as Formula 4. I think I'm going to cut this presentation right here at the stiffness of the arms and legs, just because I am running out of time. And Linda, I know you said that you had a good testimony that you could share in a very short space of time. If you can do that in about 3 minutes, that'll be great.
Yeah. Thank you, Sean. That will be quick. very quick. It's third-party testimonies. Many years ago, we had testimonies on the stage at our ADTs of people, I think it was like a contagious thing. Somebody had a bone density scan before starting to take our CalMag and afterwards again. And this person testified of increase in both bone density. That's, as I say, third party, I just heard it and I don't know how much. And then a few people did the same. I'm very sorry I didn't do that, but anyway, it's too late now.
Never too late.
So that was interesting because I always heard that calcium cannot go back in the bone, you can only prevent it. So that was very interesting. And then there was a lady in Bussi's team, Nestor Mashali. I always remember this woman. She was medically, I don't know if you in English said boarded medical pension. Correct. Because of back problems. She couldn't do her work anymore and she has osteoporosis in her back, vertebrae, wherever. And I went to see her in Umlazi the days that I would still go to Umlazi. I did many things that I wouldn't do today, but anyways, yeah, and she started taking the CalMag and she took it for a long time, for many months. And at some stage, I cannot actually remember where I heard this, via the grapevine or from her, that she's back at work. I don't know at which hospital, what happened to the pension, the boarding, whatever, I don't know. But the density in her bone density has increased so much, her back has healed, and she's working again. She was accepted again. Okay, that is just very briefly about those things. I don't think we must tell people calcium will make it go back, but this just happened. Yeah. I just heard it.
Correct.
And then my other testimony was about varicose veins and also about CalMag, but we didn't do varicose veins tonight.
Yeah, that
so
will go
next time when you do varicose veins, if you're going to do, yes, also a very brief one.
Perfect. Thank you very, very much. Yes, and we can't say that the calcium will reverse osteoporosis, but I too have heard and seen results. Unfortunately, you're never going to get it back 100%. And obviously, the younger that you start with your calcium supplementation, the better. But it's never too late to get on your calcium and take it, specifically our chelated form of it, because it's chelated, your absorption is in the region of around about 80%, whereas most commercial calciums on the market, scarily enough, even those prescribed by doctors, you're going to get between a 10 to 20% absorption. So not very much. And the doctors will also tell you to be careful that taking too much calcium can lead to arteriosclerosis, which is hardening of the arteries. Calcium carbonate will do that. Calcium glycinate won't do that. We have a calcium glycinate. So I'm going to have to cut it over here because I see we are about out of time. So thanks, everybody. My apologies for rushing this a little bit, and I will pick up where we left off next week and go into the third version, part 3.
Yes, thank you, Sean.